Assalamualaikum and good evening to our lecturer and friends. Today, our group is going to present about risk assessment in handling COVID-19 sample. What is risk assessment in laboratory? A risk assessment is a term used to describe the whole process or method of identifying potential laboratory hazards that exist or may arise, which laboratory risks are likely to cause harm to laboratory personnel and other persons, and analyzing what might happen if a hazard occurs. In every part of laboratory environment, risk must be considered. Importance of risk assessment. First, risk assessment can provide a safe laboratory environment. Then, it can give critical information for improving laboratory safety. Besides, developing suitable procedures. Next, ensuring that all laboratory members are adequately trained. In late December 2019, a previous unidentified coronavirus, currently named as 2019 novel coronavirus, emerged from Wuhan, China, and resulted in a formidable outbreak in many cities in China and expanded globally. Coronavirus disease COVID-19 is an infectious disease that caused by SARS-CoV-2 virus. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. There are 5 steps approach on accessories on COVID-19 sample. Step 1. Hazard identification. Step 2. Identify activities that might cause exposure. Step 3. Consider the competencies and experience of laboratory personnel. Step 4. Evaluate and prioritize risks. Step 5. Develop, implement, and evaluate controls.
The first step in the risk assessment process is the identification of the hazard associated with infectious agents. For the handling of COVID-19 infection, we must know the characteristic of the agents itself in causing the infectious disease. By doing that, we can minimize the risk exposure of the infections. For example, the infectious agents involved in COVID-19 infection is a RNA virus which belong to coronavirus family. For the mode of transmission, it can be transmitted through respiratory droplets or direct contact with people who are infected. It can also be transmitted indirectly through contaminated surface as it can stay few hours on surface area. In the laboratory, the procedure of handling the COVID-19 sample can be a critical procedure which can expose the laboratory worker to the infection. So, it is very important to know the mode of transmission of the virus and follow the laboratory safety to prevent the infection. Next, incubation period of the virus. Coronavirus has 2 to 14 days of incubation period for the symptoms to occur. The symptoms can range from mild to severe, depends on each individual. But there are also asymptomatic cases which can be difficult to detect. Last but not least, we must know the treatment or vaccines that are available. The treatment available for this infection can reduce most of the symptoms, unless in severe cases, the treatment are limited. There are also many vaccines developed for these COVID-19 infections as to control the spread of this virus.
Next, I will present about the risk assessment number 2, which to identify the activities that might cause exposure to the agent and materials. The agent or materials we are talking about is COVID-19 virus. By identifying this activity, we are able to prevent the large-scale infection in the lab. These are the activities that can cause the exposure to COVID-19. First, the cross-contamination can occur in the lab when the laboratory personnel does not wearing and remove the PPE correctly. Secondly, we are able to expose to COVID-19 when the workplace does not sanitize properly after handling the sample. The proper way for sanitization is by using 70% alcohol. Next, the presence of workers that does not being honest by deceiving their health status means that they probably already infected by the virus but still won't come to work. Next, when the specimen receiving does not package and storage properly, the specimen able to leak and spill during the specimen delivery that can infect the public. And lastly, as when the specimen does not dispose and managed by follow the SOP, we will able to infect the other workers due to our negligence.
Step 3, we need to consider competency and experience of laboratory personnel. So, why this training is important. First of all, the training provided will teach and expose laboratory personnel, especially new staff, in laboratory management during facing this pandemic. Secondly, the training provided is intended to support staff working in a laboratory that handles or processes specimens associated with COVID-19. Then, the laboratory director must ensure that each new staff hired receive adequate training so that they understand each task and responsibility assigned, especially specimens that are associated with COVID-19. Then, each laboratory must have at least one staff who has experience in laboratory management so that they can provide guidance to a new staff and make sure the workflow in the laboratory management runs smoothly. Next, effective training will ensure personnel are knowledgeable and competent in their assigned roles and responsibilities. Last but not least, laboratory director must ensure personnel performance result in consistent, predictable, and high-quality outcome. So, why this training is important? First of all, the training provided will teach and expose laboratory personnel, especially new staff, in laboratory management during facing this pandemic. Secondly, the training provided is intended to support staff working in a laboratory that handles or processes specimens associated with COVID-19. Then, the laboratory director must ensure that each new staff hired receive adequate training so that they understand each task and responsibility assigned, especially specimens that are associated with COVID-19. Then, each laboratory must have at least one staff who has experience in laboratory management so that they can provide guidance to a new staff and make sure the workflow in the laboratory management runs smoothly. Next, effective training will ensure personnel are knowledgeable and competent in their assigned roles and responsibilities. Last but not least, laboratory director must ensure personnel performance result in consistent, predictable, and high-quality outcome.
Evaluate and prioritize risk is one of the steps in approaching the risk assessment. Risks are evaluated based on the likelihood and the consequence. Likelihood is mostly based on the procedure, but it may differ based on the persons, procedures, and facilities. For consequence, it based on the agent. So, in COVID-19 cases, the consequence is it may cause COVID-19 mild severe illness that can lead to death. The hazard consequence is moderate to major. In determining the likelihood, we determine in several tasks. For example, in preparing the COVID-19 specimen for RT-PCR test, it is likely to be exposed via droplet production during handling the sample. For another example is touching contaminated surface or instruments. The likelihood is moderate to be exposed via mucous membrane. For risk evaluation, we can get the risk by looking at the risk assessment matrix. This is the example of risk assessment matrix. For COVID-19 risk evaluation, we can evaluate based on the task like I stated in the slide before. For the first task, which is in preparing COVID-19 specimen for RT-PCR test, the risk that we get from the risk assessment matrix is high. In touching the contaminated surface or instruments, the risk that we get also high.
So, for my take is, discuss about develop, implement, and evaluate control to minimize the risk of exposure of COVID-19 sample.
Firstly, for key consideration of risk assessment, we must know and identify the unusual situations that may occur in lab when handling the COVID-19 sample, such as leaking specimens, broken specimens, and have a small spills. Based on this, they can develop, implement, and evaluate control to avoid anything that may give problem in the lab. Before implementing controls, need to ask some question review in the lab. Firstly, are all identified controls or equipment available? Is the biosafety cabinet certified and well maintained? Are staff trained to properly use, maintain, and dispose PPE and equipment? What level of competency have staff demonstrate? After implementing controls, they need to invite feedback from staff and need to do the planned routine reviews to ensure risk assessment is accurate and control strategies are effective. So, for the develop the control in the lab, one of it is administrative and work practice control. Firstly, the staff must train experienced staff knowledgeable of COVID-19 symptoms. Then, unpacking of specimen performed in a Class 2 biosafety cabinet. Then, the personnel must complete a class of training in how to handle COVID-19 sample. After that, there must wear PPE and N95 respirators when processing SARS-CoV-2. And lastly, the patient under investigation, or known as PUI specimen, must send directly to lab.
For engineering controls, firstly, the Class 2 biosafety cabinet must isolate and limit the lab access. Then, the centrifugation of blood specimen should be performed using sealed centrifuge rotates of sample cups. These rotated cups should be loaded and unloaded only in a BSC.